Hi there, I'm Lily. Welcome to the Vital Horse podcast. I'm a veterinary surgeon passionate about what our animals' behaviour can alert us to. I focus on nurturing the innate nature of animals to address the deep roots of health, well-being and vitality. Our relationship with our horses is an inextricable part of this. I am guided by what they show me. Many people say, if only they could talk, but they can tell us so much and we can communicate back. This podcast is about you being able to help your horse fully by finding out what's going on, deciding how best to help, and then doing this ethically and effectively. In this way, we can investigate and treat behavioural signs and underlying health problems, pain, or dysfunction in our horses while actually improving our relationship with them. Let's find out how. In this episode, I talked to Sarah Schlote about trauma-informed relationships with our horses. I met Sarah at the first Journey On podcast summit in San Antonio, and I took hers and Steve Peters' Equiscience Masterclass, a trauma-informed and neuroscience-based lens on horse-human relationships, and I knew I just had to talk to her about some of the cooperative care stuff like needle shyness, but also just our wider relationships with our horses and with ourselves. Sarah Schlote, MA, RP, CCC, SEP, is a bilingual registered psychotherapist, Canadian certified counsellor and somatic experiencing practitioner with extensive training and experience in a number of trauma treatment approaches. She is the founder of Equisoma Horse-Human Trauma Recovery, looking at the intersections of trauma in equines, trauma in humans, equestrian trauma, and how to move from reenactments to renegotiation and healing for all, regardless of species. Equisoma is offered with the licensing permission of Somatic Experiencing International and features the application of the work of Dr. Peter Levine to other species and to human-equine relationships, along with other relevant frameworks, principles, and concepts. Her focus goes beyond behaviorism and is informed by ethology, somatics, attachment theory, equitation science, interspecies social justice, and relational rupture and repair, among other areas of study. And to learn more, visit sarahschlote.com and equisoma.com, and those links are in the show notes. I'm sure you will enjoy this conversation as much as we did. So hello, Sarah. Thank you so much for joining me. I'm really excited about this conversation.
Hi, Lily. Thanks for having me. I'm looking forward to this after our last call when we had a chance to connect and just deep dive on a whole bunch of fun topics that I think we both really enjoy. Yeah.
Yes, so much fun. Yes. So I kind of plan to see in this one just where our conversation takes us in general. But as a start, I guess it would be good if you just opened with a bit about your background and how you kind of came to see and do things in the way that you currently do. You can take as much time over it as you like, really, because it usually helps with the rest of our conversation.
Sure. And it might provide some jumping off points as well for additional. So it's fun for me to be having this call with you today, Lily, because when I was a kid, I wanted to be a veterinarian when I grew up. And that was like my big thing. I was either going to be like a paleontologist because I was a huge fossil nerd, or I was going to be a vet. And then as life happens, you lose a dog and, you have to deal with the grief of the loss. And I was like, I don't think I can do this. And I switched gears entirely. And when I was in high school, I got really interested in psychology. I still like biology and everything. I was a bit of a overall nerd and liked a lot of courses. And then in university, I wanted to be a speech pathologist of all things. Interestingly enough, people might be surprised to hear this. And so my undergraduate degree was in linguistics and literature. And so I was trying to line myself up to get into the speech and language pathology field. I had a cousin who was in it. I had done like a volunteer placement in high school with a speech pathologist and really liked it. And so that was my trajectory. But I always loved animals, and animals was always a thing. And somewhere in my undergrad degree, somewhere along the way, I watched a documentary. This is ages ago. Like this would have been somewhere between 98 and 2002. Gosh, I can't even recall what year it was, but I came across a documentary for a place in New York called Green Chimneys, which does animal-assisted therapy of various kinds. And I was like, oh, this is amazing, and I was very, very intrigued by this whole thing and very enamored by it. And promptly made it my mission to learn everything I possibly could about that field. And I deep dived or dove, deep dove? Can we say deep dove? I did a deep dive. That's maybe better. I did a deep dive into that for a few years. And because I was still figuring out my career trajectory at that point, and it became clear partway through my undergrad that I didn't want to be a speech pathologist. So I was still sort of floating around and where I was going to go. And it was around the time of ending my undergrad that I started volunteering it was probably just afterwards, I started volunteering for a therapy dog program that I went through all the tests. I had a rescue dog at the time. And I was like, gosh, this would be so cool, And so we did the evaluation thing where they test the handler dog team to make sure, everything is on the up and up. And I started going to this nursing home. And it took me a little while because I wasn't entirely paying attention. It took me a little while to realize that my dog was not enjoying this. Yeah. And this was probably somewhere around 2004, 2005. I started to get this wondering as to why my dog was behaving a particular way around the residents in this nursing home. In some instances, she'd be okay or seemingly okay. In other instances, it felt like I had to force her. Yeah, I hate admitting this now, but you all start somewhere. We all start somewhere, don't we?
Absolutely.
Right? And something was starting to click in that I was like, everything I've been told, animals, therapeutic things, and it was already starting to crumble a little bit for me. So I was like, oh, this is really strange. This might have been around 2005 or so by the time I really started to clue into what my dog was telling me. And I finally made the decision to retire her from being a therapy dog. And we stopped volunteering. And I felt badly because I liked volunteering. I liked giving back. I liked all those things about it. And I recognized there was some value or some benefit for the residents, some of which don't get a lot of visitors. And when I was in high school, I worked in nursing homes as my school job. And back in the day before, I don't know what you have where you live in the UK, but there in North America, we used to have healthcare aides where you could go and learn how to give baths and feed and do lifts and things like that for residents in long-term care facilities.
Yeah.
Yeah, and then that became not a licensed profession, but that eventually became a profession that you needed to do a college diploma to be able to do that work. But back when I was in high school, you could learn on the job. It was not considered a skilled trade like it is now. And that might not be true everywhere, but certainly that was true here. And so I knew that folks in nursing homes often didn't get visitors and that they're kind of just parked there, and it's quite sad. And so I felt badly because I could tell that it was helping them, but I didn't want it to come at the cost of my animal, who was clearly making it really clear she was not keen anymore. And so I started to dig a little deeper. And in the process of all of this, I realized through a different trajectory of my life that I wanted to become a psychotherapist because I had my own history of developmental traumas and relational traumas and things. And I got very, very passionate about that. And somewhere in there, I was introduced. I went off and did my master's degree at the University of Victoria. I got a master's in counseling psychology and did my thesis on the field of animal-assisted interventions. And while I was in my master's degree, I had the good fortune of being offered a scholarship to attend an equine facilitated learning weekend thing. And I was hooked. And this felt very different from the dog and nursing home scenario. And I knew it was different because it was more of a facilitated interaction It was a bit of a different intention. And that led me onto my journey with horses, because I did not grow up with horses. And that sort of took us to today. So in the process of all of this, getting involved, doing trainings in various therapeutic modalities, for humans related to trauma, one thing that kept jumping out at me was, and in my own experiences of offering equine facilitated, whatever you want to call it, there's so many acronyms, because there's so many variants, I was starting to notice these weird dynamics showing up sometimes from time to time, like between, say, me and my co-facilitator, and that might impact the human client or the animals that were involved, or things where the animals were being forced to do stuff which harkened back to my experiences with my dog. And differences or discrepancies in philosophy or awareness of self or awareness of one's own patterning. And it was around that time that I'd gotten my first horses, and it was also around that time that I had started training in somatic experiencing, which is an ethologically based model of supporting trauma resolution, broadly speaking, by looking at animal models. So animals in the wild being able to kind of move through their responses and not carry the kind of load or charge in their system, and not having the sheer amount of, health diagnoses and difficulties that we see captive animal populations have. And why is that? And that became a model for helping to support trauma recovery in humans, but it started with animals, interestingly enough, and a number of other sources of knowledge and information. And it became really evident to me that I was like, this is really interesting. This started with the animals, but why are we not bringing this knowledge back around to the animals?
Yeah.
I mean, this is based in animal ethology. Why is our main primary approach to animals behaviorism? There's nothing wrong with that inherently, but there's more to the picture. Like in learning how to use behavioral methods and operant conditioning well is important. Like that's still a very important thing. And there's more to the picture than just that. And it felt like this other area that I was learning, weirdly enough, through my human therapist world, which came from the animal world and is very much openly disclosed as such, why I wasn't seeing it in the animal world. And like, why is this not also carrying over? And so multiple reflections on anthropocentrism later, I was like, let's see if we can bring this back around, shall we? And that's sort of what brings us to where we are today. Yeah.
I love it. Yes. Brilliant. So loads of things. I have so many questions coming off of that.
Sure.
And if, well, we talked about this a bit in our last conversation, and I've already gone over it in some previous podcast episodes, but if I just briefly explain what part of what forms my thought framework about health and well-being is that this is just one way of thinking about it.
Sure.
I kind of started to categorize any problem with unease or disease or whatever you want to call it as falling into one of four categories. And I call them husbandry for happiness is the first one, and that's all to do with lifestyle and it needing to be species appropriate, which is quite important. The second one is movement medicine, and I've done a bit of a deep dive into postural stuff, and not just the kind of physical, physiological part of that, but emotional interplays with that as well. And then the third one I call cultivating comfort. So that's addressing pain and discomfort, and that could be they could be physical, although pain is not only a physical thing, but it could be so-called physical pain that has a pathology associated with it, or it could be a more emotional discomfort kind of aspect. And then the fourth one is kind of the relationship piece. So I call that one communication, compassion, and consent. And it would be great if we could talk a bit about that bit, because there's two kind of main things that I was thinking about talking to you about. One is how it impacts on health in general, any kind of trauma related experiences in either the person or the horse in that interaction. And with relevance to a veterinary focus, there's often more than that number of people involved. And then the second one is for carrying out husbandry and veterinary procedures. So if horses were free roaming or managed more sort of distantly, I suppose, from people, then there might be some things that didn't come up in our interactions with them. But in the course of asking quite demanding things of them, for example, even just sitting on their back, I think is a pretty tall order. It's an amazing feat that we do it successfully. And then it's almost no wonder that sometimes we don't do it successfully, I find. But then also, in order to just look after them effectively, we need to be able to carry out certain procedures to safeguard their health and well-being. And particularly relevant to that are some phobias that horses can have about certain procedures. So at the moment, I'm running an online course on needle shyness, and that can be a very challenging situation for everybody involved because it can get quite dangerous, and it can also be vitally needed in certain situations. It might not be a negotiable situation that we can avoid doing. So I guess the first thing that would be great to hear your take on is a physiological expression, if you've come across this, of a trauma response in horses themselves, because I wonder quite often with certain patients whether we're not fully getting to the bottom of what maybe seems to be a physiological problem, but actually has some roots in a trauma response, perhaps.
And I was going to say, even backing up on the two areas that you wanted to talk about when you said movement and posture, that also feeds into this as well. I mean, all of these do, because the body is where we hold back and we hold in and we hold on. And so difficulties with movement and posture can reflect certainly conformation things and breeding things and injury-based things. But how much also of what we're seeing is bracing patterns and holding patterns that reflect having to hold back or suck in or manage something that I'm not allowed to express, because if I were to express it, I get punished.
Yes.
And so sometimes what we see there is actually reflective of those other categories. So all these categories, interestingly, are not these separate silos, but they're all feeding into each other. So I just wanted to name that before we continue, because I was like flagging on that going, oh, but that too, is potentially part of all of this. But your question being about expression. So maybe I'll back up before I answer that question and speak a little bit more about what do we mean by trauma, broadly defined, because I think that terminology can sometimes be misleading or confusing. And certainly you'll see in the literature and in various places, well, how do we even define trauma? Like, are we even talking about the same terms and conditions here? And so we can all be on the same page. So I'm using a really broad spectrum definition of trauma that isn't like so narrow. So some people will narrow the definition down to, say, I think in humans, post-traumatic stress disorder would be, what their limited understanding of trauma might look like. And certainly that's a variant. It's very incident related. There's avoidance behaviors related to the thing that there's fear related about, efforts to avoid the thing that carries charge and associated fear, and difficulty with regulation, difficulty in various areas as a result of that. And there's more to a PTSD diagnosis. But it's not always that. So when I say the word trauma, I'm usually speaking on a much broader spectrum across the lifespan, and it includes things that maybe we might not consider to be trauma, like relational ruptures that have occurred, or I think of things like forced and abrupt early weaning, for instance, being a very early developmental rupture, and that is not always done particularly well in captivity. And often younger than what would happen in the wild or in free roaming populations, and often very quick and very sudden, and results in a lot of stress. And so that would be a trauma, loosely speaking, right? If we were going to consider this broader definition, including these things where something happened and life went awry compared to the normal trajectory that a given species or a given population evolved to do well in, basically. And that doesn't mean that there isn't adversity in life, but that when the regular conditions are there, when the species gets to evolve as intended, there's actually more resilience to cope with the adversity that may show up in life, because those sensitive and critical periods of development unfolded again as they should have, quote unquote, more or less.
Yeah.
And so the more safety and security there is in the herd between the mother and foal bond, the more ability there is to develop secure attachment, the more the nervous system learns that what goes up can come back down in relationship, the more that there's resilience. It's like, oh yeah, my nervous system will mobilize and we'll come back through and we'll be fine. And we'll come back down to this safe place of being with each other and enjoying life. And I've met Lucy Reese, and I just did an interview recently with Dr. Emily Keeson, talking a little bit about free and wild roaming horses and how, like, in the wild, it's not dramatic. It's quite like there's a lot more affiliative behavior than there would be conflict behavior. And the presence of conflict, so much conflict behavior in domesticated equines is, if you're saying, what would a trauma response look like? If we're going to view this definition of trauma as being a series of things and experiences that over time have resulted in a deviation from normal course to the point where there isn't a return back to the intended set point. And not by a set point, I don't mean a singular baseline. Allostasis is this idea that it's stability through change or stability through variability, as in a nervous system that has good resilience is one that has the ability to vary in response to the needs and the demands at hand, not one that has a set point as a glorified endpoint, right? That's maybe some systems have homeostasis in that way, but not all systems do. And we have a mix of homeostatic processes and allostatic processes. And so this idea of a nervous system that didn't learn this, that doesn't have a very flexible system that moves through states in a reasonable amount of time, and has a fair amount of security and stability and ability to move through experiences in a particular way, we might say there's a trauma pattern there, or there's a deviation from the natural course of things, for lack of a better expression, where something happened or a series of things happened that exceeded the capacity, where what went up did not come back down, and there was nothing to come back down to. There wasn't the safety of connection and security and a baseline of regulated, range to land in. And so when we see what we might call, loosely speaking, a trauma response, I think about it more in terms of broader than just the classic PTSD. I have a fear response in response to something specific that was involved in a bad experience or something like that for me. But more so broader, I mean, that's included, but broader than that, it's what are we noticing in the states and the ability to state shift? Is the baseline state one of fight or flight? Or is the baseline state one of freeze and collapse and shutdown and bouncing back and forth? And how do we know? Can we tell when there's appeasement? Because appeasement looks a heck of a lot like affiliative behavior. And agreeableness is not always a sign of calm and safe sociality. Being agreeable can be a sign of appeasement, compliance type behavior to prevent more harm. And so for me, it's more of a question of, well, what are we noticing in the nervous system patterning and in the relational patterning, which layers on top of the nervous system patterning? And what are we seeing there? And does it deviate from what we would expect to be the normal course of things, so to speak? So does this animal, even this human, have the ability to come back down and have a feeling of being safe and enjoyment with each other? Or is there a disconnect? Are we perpetually in fight or flight with each other? Are we checked out and not even attending to each other? Are we in what Dr. Peter Levine calls a functional freeze, where we do a really good job of looking like we're doing well, but in reality, we're not at all connected to big parts of the picture, because those those aspects of the picture were not recognized, or the needs weren't being met. And so we learned to just not notice them anymore. And if we weren't noticed in our needs, it sometimes can be really hard to notice them in ourselves and also notice them in others, which was what I figured out was happening a little bit with the therapy dog program that I was in for myself and my dog. It was like, oh, I don't even know that I didn't know that I was that disconnected from my own thresholds, my own sense of overwhelm, my own sense of overriding. And so it took me a while to pick up on it in my dog. But I eventually did, and I'm eternally grateful for her for being so patient with me. That it just took me a while to clue in. But it's like that too. And so it's not always going to necessarily be a large response that we might call, oh, that's a trauma response. But I think more broadly speaking, in terms of what's the patterning that we're seeing here. And within that, there are responses, certainly. And if you don't like the word trauma, fine, let's call it adversity. Let's call it chronic stress. Let's call it relational disruption. Fine, like whatever word floats your boat is fine. I picked the word trauma just because it's easy. But something isn't working as intended. Our nervous systems are not meant to live in fight, flight, freeze, appease, collapse as baselines. That's meant for short-term use, and it's meant to have a function, and we're meant to resume functioning within a range after the need for that is passed. And for so many domesticated horses, what goes up doesn't come back down.
Yeah.
Whether it's the conditions or the environmental conditions or the relational conditions or both.
Yeah, that's so important. And also you touched on the lifestyle aspect there as well. So there will be factors in a horse's history that affect their ability to be agile within their nervous system states. And so weaning is one massive thing. And there's such an interplay between that and physiological processes. So both at the time and then setting them up long term, because these, whatever it is you do want to call it, chronic stress might be a good term to sort of link to physiological things. There'll be effects on gut health, on endocrine systems, on the immune system, on posture. You can have a horse that's perpetually in a sort of a cringe nervous system, sympathetic nervous system type of posture. And then also, it's really important what you said about appeasement. And that's something that I talk about in my needle shyness course, actually, is actually if you have a horse that is currently very obedient for needles, maybe don't necessarily expect that means that they're totally fine with it. We have to maybe dig a little bit deeper than that. And their response, they might actually still be, I don't know if worried is the right word, finding it difficult, and their coping strategy is this outward expression. And so what can we learn from each individual horse? It isn't a labeled sign that lets you know what they're feeling. And this is a theme actually that keeps coming up. So lots of people will ask a vet, what does this sign mean? And it doesn't necessarily point to a particular underlying process. It's an expression of a mechanism that's going on, but it doesn't necessarily lead you to a diagnosis. You have to do a bit more digging than that. So you could have a very obvious kind of panic response, for example, or you could have an appeasement type of response, but they're both pointing towards the same underlying process. And yeah, so that's a theme that goes across everything, and it all is so intertwined and enmeshed. It's a wonder that we can ever actually tease anything apart.
Yeah. And I think that was one of the things I appreciated so much from my training in somatic experiencing, which, and then continuing with that model, I'm trained in a lot of models, but this one particular one has really shaped a foundation for me that influences how I do every other thing that I'm trained in as well. And I think because it's so biologically based and neurobiologically based specifically, that it's like everything I see is going to be through that lens, even though I'm using a different map or a different approach. I'm still watching what's happening in the physiology and in the relationship through that other lens. So even if I'm not doing that, it's still informing what I see. And this teasing apart piece is a huge part of the training in somatic experiencing. And Dr. Peter Levine calls it coupling dynamics, where he doesn't use the language of behaviorism. He's using slightly different language here, and I like his language for it. It kind of makes it, I think, a bit more accessible. Overcoupling would be when things start to happen together or start to combine and over associate when maybe they don't need to be. Like, I notice this thing happening and I feel this sensation, and then I start to have this emotional response and this thought about it, right? And this happens in rapid succession, and these things have now become overcoupled, right, so to speak. So we're trying to tease apart these things to help create, to work through the charge of all these things glomming together. And then undercoupling would be where this thing and this thing should be associated, but they're not. So in a human, it's like a human who's talking about a really tough experience, but is showing no emotion.
Right.
Right? They can intellectualize about something, but have absolutely zero access to bodily sensation or emotional expression. Undercoupling. These two things should be on some level connected and are not. And I think we might talk about in behaviorism, perhaps more like classical conditioning would be an example of overcoupling. Like, these things have now become paired. And I guess the closest I can think of undercoupling would be extinction, but not quite entirely, but sort of, but not quite. You know, and so because like dissociation, for instance, would be an example of undercoupling or undercoupling. But that wouldn't necessarily be an extinction response, right? So I don't think all extinction is undercoupling, but certainly some might fall in that category. So it's a terminology I really like because it encompasses this thing about how do we start to tease apart all these bits and pieces. And SE really does a wonderfully nuanced job of teaching us how to do that. And one of the things I will say to people is, and I get this all the time in our training program, and I get this all the time out in the world also, is like, oh, I noticed this thing. What does it mean? And my response is always, well, it depends. You know, and people have gotten kind of used to me having that be my first response to people, is going, well, I don't know enough information yet. Let's back it up. You know, because if things are happening in a sequence, because they always do, and that sequence might be complex. And if I think about my dog and I in the therapeutic, you know, therapy dog program thing. And if I myself am undercoupled about certain aspects of my own experience of life, and therefore I'm not seeing it in others perhaps as well, I'm going to miss a whole bunch of cues. In myself, in the world, in the other, that I've learned to maybe extinguish, to use more behavioral language, to disregard. I just don't notice it. Because not noticing is what helped me to survive. What was the point in noticing it? Nothing was changing anyway. Why bother even paying attention to this stuff? Because it doesn't make a difference, right? Would be an example. And so if I myself, as part of my coping in the world, has been to uncouple aspects of my experience in order to not be so overwhelmed by what seems overwhelming and seems unresolvable, I might not notice it. So I might ask the question, go, oh, what does that mean? And I go, let's see if we can recouple back in some of what's missing in the sequence. Like, how can we start to get curious earlier, before that, and then before that, and then before that? Not just for the animal, but its environmental conditions and what's going on for it and its herd mates, and in the environment, the physical conditions, and also you as owner, and you as vet, or you as horse trainer, or like, how is all of this creating stacking to a certain degree? And then what we see is here, but in reality, there's all sorts of variables leading up to this point. You know? And then what happens afterwards? There's usually some sort of fallout, and then what happens next? So getting to know that sequence and thinking in things more systemically in terms of sequences as opposed to singular behaviors starts to completely change the game. Yeah.
I love that, because I use an approach in evaluating patients, so examining them. I prefer to maybe use the word evaluating, actually, because it isn't all examining with a sort of hard focus. I think it really helps to slow down a lot and then also sometimes increase the distance, whether that's literally or I don't know about metaphorically, but just slow down. And some of the feedback that I get from people, and also something that I notice myself, is that it can be a real practice. Well, it is a real practice to so the process that I'm talking about is trying to just notice anything that is available to notice, no matter how subtle it is, and to try not to attach an interpretation to it straight away, because then what tends to happen is you get a tunnel vision about it, or you spiral into what does this mean? And sometimes that can even lead into, oh no, but it can't mean that because this would mean this. And and then we end up tying ourselves up in knots or coming to a conclusion that actually is not at all related to what we just observed.
And that would be a great example of coupling dynamics right there, right? Is like, oh, what is it this? And then I go into my head, and then I go into all these associations, and now I'm down this path all the way over here, and I've left the moment. And now I'm caught up in my own stuff, my own emotions, my own thoughts, my own experiences. And now we're way over here, and there's all these layers that have now gotten brought in that they themselves might need some support. Especially if, like I start to connect with guilt and shame as an owner, like what might this mean? And the meaning channel often is the one that is people go to the first, because that's, I think mostly I would say in Western educational systems, we're taught to be sort of thinking creatures, but we go into the meaning route, and then a whole bunch of stuff starts to couple in quickly around guilt and shame and inadequacy, or maybe I'm remembering the fall I had from my horse, and I start to feel charge around that, and my head injury layers into this because now I've got a bit of emotional dysregulation from my brain injury, and now woof, we're in the human's trauma pattern, so to speak. Right? And it's like, and then in the meantime, as the human's doing that, what's going on for the animal? Right? So both nervous systems are in relationship with each other, and both nervous systems have a history and a set of coupling dynamics and a set of things that are layering in and stacking. And it's like, okay, let's slow this down and let's see if we can be curious without jumping too quickly ahead.
Yes, being curious, and then bringing in a huge amount of compassion with what it is that you do notice, because we do have a tendency, it's a very human thing to jump to a judgment about something. And even if your intention is that you're trying to help, that's usually the situation. But then it's difficult to see it for what it really is. And then you may go into your trauma response again.
Sure. Well, sure. And going into judgment for many, it's not just, again, the meaning channel being, one of the ones that we're most familiar with, but self-judgment becomes a mechanism by which we can avoid feeling more emotional pain. If I'm in my head judging myself, I'm not feeling my feelings and sensing my sensations. I'm in the thought of the thing. And so it's one way to disconnect from what's there, which invariably, interestingly, keeps it at bay, but then it doesn't ever release and move through. And the stuff is meant to, again, what goes up comes back down. And so that patterning, interestingly enough, shows the evidence of what often happened for horses in captivity, of what went up did not come back down. And for so many humans, what went up did not come back down. And we see it in their management patterning, or their mechanisms, their coping mechanisms. And weirdly enough, self-judgment and self-criticism, people might be like, what do you mean that's a coping mechanism? It sounds more like I'm being really hard on myself. Yeah, but going there allows you to not feel. It's a way to disconnect from what's here because you're up here. And it's also a way to prevent future issues. If I can just be harsh on myself, then maybe I won't do that again. Right. And so it has a self-protective function. And then how do we, again, like I said, I love how you said that, like, how do we hold the compassion and slow this all right down? Because all of that sequencing speaks volumes to what was missing, what didn't get to happen for the human and or for the equine. And so this is where the human's patterning and history and what went awry there is we also as humans have things go awry. what went awry there starts to influence how that human is able to relate to their animal or recognize what's happening in the animal without getting dysregulated themselves or what have you. And this isn't a criticism or a blame of the human. It's more of a, hey, you had something happen to you too, or a number of things. And both of you are deserving of support and, to work through all of this complexity, because it can be complex. Yeah.
Absolutely. I think the compassion piece is almost, not that you can really give a ranking here, but it's almost more important for the human part to have that self-compassion in order to then be able to serve the horse better. Because I think if we do get too stuck without that self-compassion, then things can enter into a place where it's not really serving either party. So interesting. It's a brilliant subject. I'm aware that we could probably talk for about 5 days without stopping. And there were a couple of specific sort of practical implementation things that I kind of wanted to ask you about. And so this is relevant it's most particularly relevant for needed husbandry and veterinary procedures, where so my ideal approach to that would be to teach a cooperative care behaviour, which would allow the procedure to even be done at liberty. But being realistic about things, there are some experiences that some horses have had in the past, or there are some situations where that wouldn't be possible. And I'm specifically really thinking about urgent and emergency situations where there may be pain and panic involved in what's just happened to induce the emergency or the urgent situation, and your cooperative care procedure might break down. So cooperative care procedures, I'm really, really invested in building those, especially for routine work, where if it's a little bit falling apart when you're going through the process and the animal is telling you that they are not in a position to have this done today, you do actually have the opportunity to leave it to a different day. But I'm more thinking of a situation where that's not possible. And so I've been trying to figure out the whole restraint or immobilization question, because physically holding is actually, it's not usually effective anyway if a horse is panicked enough. But maybe containment is a thing, say for example by a barrier, or chemically induced immobilization with sedation. That might not be possible in certain emergency situations because it may require a needle if they are explosive with needles, for example. So there's a lot here, but basically my thoughts on it are that in general, perceived forced immobilization is unlikely to be very helpful long term. It might be needed from a safety aspect in an emergency or an urgent situation. And what might we be able to do either in the moment or as a kind of a repair and recovery afterwards if we have needed to employ those kinds of things? And being mindful of the fact that we would probably prefer not to. There may be some repair of our own kind of pain to do with needing to do that time as well.
So, gosh, I've got so many layers here. So I'm going to preface my response to this by saying I'm not coming in as a clinical animal behaviorist. That's not my training area. There's a lot of parallels between my background and what I do and how I see the world and how someone like that sees the world. And I've had some interesting conversations with folks like this, and have a number of colleagues who are sort of either certified animal behavior consultants or clinical animal behaviorists. And I have an interview on my channel with Debbie Busby.
Oh, yes.
Yes. And so they're a parallel profession that I have a lot of affinity with. But I'm not going to be speaking because I'm not that. And so I might share some things here that might align with someone who is in that profession. I might share some things that are a little bit different. And I'm going to try to come more from the perspective that I'm bringing to the picture, and there's more to the picture than what I'm going to share here, of course. Okay, so I'm not presenting the entire scenario of what can happen, but I'm going to name some layers that I'm attentive to.
Okay,
yeah. Okay. So, and this is a broader answer than, well, here's a specific case and here's how I would proceed with a specific case, because the more specific a case is, the more specific I can be in my response. So this is going to be more broad spectrum, just as a preface. So, so if I back it up and I think a little bit about how do we, even before an emergency happens, how are we preparing for emergency situations? And I am going to be the first person to raise my hand and say, I'm not ideal at this. I have ADHD. I struggle with executive dysfunction and overwhelm on the best of days. Like this is, and a thing that I know is hard for folks is to be intentional about implementing things in advance or preparing for a moment in the future where you're going to need some sort of thing. And I think of like trailer loading, right? Like, oh, my horse never leaves the property. My vet comes to the property, but then there's an emergency and your horse hasn't been on a trailer in years. And then you're having to deal with that in the moment. Not ideal. It happens. Ideally, what can we do before it gets to this point? Well before. So that's the first thing I always would say is, and I know that this isn't always possible or realistic, given people's lives, given people's overwhelm, given people's neurodivergence or stress responses or what have you. So I'm not saying that as a let's blame or point the finger at yet another thing people are feeling inadequate about. That's not my goal here. But even before we get to that, because the reason I'm saying that is if we're going to want to do aftercare, the aftercare for me assumes that there's going to be something available. So when I think about what I've been talking about all along, which is this what goes up comes back down kind of concept, that implies that they know what to come back down to, that they have a come back down place to land in, which presumes that that's been there prior to this unfortunate experience of having to maybe sedate or do something, and the animal's already needle shy, or there's some sort of veterinary emergency, and whoops, now we're escalated and pretty stacked and things are getting a little precarious, because these things happen. In spite of everyone's best intentions, they just do. And so I go, okay, so if we back it up, what are the conditions in the environment, in the physical environment, in the herd, and in the dyad between the owner and the horse? Is there decent enough, good enough attunement? Not perfect attunement, but what is the degree of connection between the two? Are the owner and the horse or mule, donkey, penny, what have you, pony, many, there's many domesticated equids, the equine. So between the owner and the equine, is there enough of a felt sense of safety in general between the two? Right? Like I will send you the link to this diagram that I keep drawing with my finger, because I'm referring to something very specific that you might want to have for your viewers, and you can add it as an overlay if you like on this video. Yeah. Or have it in the show notes on your podcast. That's fine with me. There's going to be, if what goes up, if we want it to support it to come back down, I think as an aftercare kind of idea, like let's say it does get to that point. Well, are we supporting the conditions, or does the animal know that what goes up can come back down and that it feels safe to move through all of that intensity, and that it will come back down and eventually come back to being in safe relationship again? Can we complete that cycle? And it's easier to complete that cycle if already that animal has access to that physiological range. That isn't fight, flight, or freeze and appease, right? It's this other range of baseline, but by which I don't mean a fixed set point, but a range of sustainable physiology that varies. It isn't just, oh, all is calm and there's no gas pedal. Like there can be play, there can be excitement, there can be energy, but that there's a perception of safety. Is that there to start with? Because recovering from such an intense, acute sort of peak and drop is easier when that's available. right? And so how are the relational conditions, environmental conditions in general in supporting access to sustainable physiology in general for that animal? So that if something were like this to happen, it has the trail of breadcrumbs to come back down to this place in the first place. I use the Hansel and Gretel example, it's like, where's the trail of breadcrumbs, and has it been able to follow it? Or is what goes up staying up, either in terms of activation or shutdown, is what we're seeing a functional freeze. And in actuality, they haven't come back down into connection again, right? And how would we know? And the specifics of that would depend on the specifics of it depends of each scenario, of course.
Yeah.
But globally, I would be very curious about that. Like, where are we starting from? What is the current capacity and conditions? Now, as you would know as a vet, this isn't always going to be realistic. Some people are in their own trauma patterning. They might be in freeze and appease most of the time and not even know it. They might be a little disconnected and undercoupled from aspects of their own experience and that of their animal, and not even recognize that maybe there's a feeling of unsafety between the two of them. They just think that this is how horses are. That's quite common, actually. And given the number of humans who are drawn to animals, many people are drawn to animals. It's not just the biophilia hypothesis, I think, of E.O. Wilson and this idea that because we're from nature and of nature, we're intrinsically drawn to nature because we're part of it. But also, like, other people might not have been safe. And so many humans turn to animals because humans weren't comfortable and go, well, animals are safer, but don't realize that they're in the same patterning with the animals. They're still disconnected and maybe a little, whatever. But compared to humans, animals are not bringing up the same obvious discomforts. And so if you have a human who has an animal and in your veterinary practice, and they haven't got that layer of awareness yet, which again is super common because we cope to survive by not being connected to aspects of our experience, or by suppressing or actively holding it in and having a lot of pain. And, why do we all see body workers, right? Like human or equine. And so if that's the case and we don't have this baseline, or we don't know if there's that baseline to start, then how are we supporting that to be there on the outcome, right? So we got to start somewhere. And this is what it is. We're entering into this patterning at the point that we do. It's not always going to be this beautiful thing of, oh, look at all this work I did on preparing for trailer loading, and look, we had an evacuation, and wow, we were ready. How many of us can honestly say that that's our case? That's not me. I'll be honest. I am not this perfect human who's got all this stuff figured out. I don't. And I recognize that that's there. I recognize. And so when that's the case, because I do have very great awareness of my own fallibility as a human, and that I'm not going to always do this correctly, even though I know what I should be doing. I'm like not necessarily able to get there because life is a lot. I then go, okay, then what's the next best thing? Right? So if the advanced prep and the advanced conditions aren't there, then what? Then I go, okay, realistically, if that isn't in place, then how are we supporting that to move through on the aftercare? And then I'm going to talk about what happens during last. The aftercare, it's like, okay, how are we supporting this? Because you said something cool a while ago, Lily, about the human might need some support in the coming down following such an intense experience, because we're nervous systems, we're going to have a response. And people have heard me say before, like, we're not pieces of celery, we're going to respond to situations. And although I'm sure celery has a response too, I heard something recently about how plants have a variant of screaming when they have been cut cold. Yeah, it's so wild.
Amazing.
Right? Wild. So here's me saying, oh, well, we're not celery, we're not going to not have a response. And I'm like, actually, that might be premature or inaccurate, and perhaps, not very reflective of the reality of a celery. But you get what I'm trying to say is that there's going to, we all know what we're trying to say here, disregarding, apologies to celery everywhere. But like, we're going to respond. And some people, interestingly, I might be hearing me say this, and I would say, they might say, well, interestingly, when that stuff happens, I feel nothing. And I go, oh, that's so interesting. That's such good information, right? Because now, is that equanimity? Is that having a good baseline of calm? Could be, but it could be. It could also be that it's evidence of that functional freeze
Yes.
kind of thing, where what I think is calm is actually not. It's just I'm disconnected from
Mm.
aspects of my experience so that I can remain appearingly level-headed in a situation. But in reality, I'm also potentially frozen,
Yeah.
but able to engage in certain degrees. But I'm not connected to aspects of my experience, undercoupling, right? I'm not connected to emotion or sensation or what have you. And so if the human, especially if the human did also activate along with the horse or other equine, then yeah, how are we supporting that human to track
Mm.
that activation and come back down? Ideally, throughout that experience, I'm going to talk about something else in a moment. I'm going to back it up. But on the coming out the other side sort of place, how are we supporting both equine and human to deactivate? And
Yeah.
right, by which I don't mean, okay, let's take 5 deep breaths, although that could need to happen because there's so much panic, maybe. And this might be bringing up a lot for the human also, because there's a lot of coupling dynamics, there's a lot of complexity. So that could be necessary, but what is going to support the coming back down out the other side, where what goes up comes back down, and then we're able to reconnect with safety? How do we recognize that the human nervous system and the equine nervous system are feeling settled again and not just functionally frozen? Are
Yeah.
they capable of connecting with each other? Do they let go of their breath? Do they have a softer facial expression, right? Are there, like, what's the blink rate looking like? Is there a return to grazing, but not snatch and grab stress
Mm.
grazing, right? But like when is rest and digest and sociality kicking back in again? And this becomes a thing to track for both.
Mm.
And veterinarians, I know, like I think about scope of practice, and I have a lot of people in my training program who are equine body workers, and they're used to working with equine as client and not exploring the human nervous system patterning and trauma
Mm.
patterning that's occurring at the same time that might be contributing to the equine's pain or bracing pattern or
Mm.
what have you, or the human's response in the moment during an equine body work session, because the human might be connecting with their own stuff, which might be part of the equation. And so it's the same with vets as well. It's like, oh, vets are trained in working with animals. You're not medical doctors. Although, heck, if there was an apocalypse, I'd be like turning to Lily.
Ah.
I'd be like, Lily, I've got this bleeding thing. Can you like give me some sutures or something? Because you're the other species equivalent of an MD, basically, right? But you're technically not allowed to treat humans. So, but it's similar to some degree. And so the human, or the veterinary, the animal doctor, may not be equipped or trained in supporting the human
No.
nervous system, right? Because it's not considered part of your purview or your scope of practice. And yet they're a mammal too. And
Mm.
so I think there's still a place for cross training or skill building,
Yes.
transferable skill building, not that you would become um, the healer of the human, but how are we holding the knowledge that mammalian nervous systems have particular traits and features and recognize that this is also playing out for the human mammal? And how
Mm-hmm.
are we allowing the time and even
Yeah.
educating the human owner to go, yeah, now your horse is, this is going on. How are we allowing it to come back down? There might be more of a fight response, more pushiness, more, the discharge of all of that pent up stuff, especially if they were confined
Mm.
or a restrained. Well, when I'm restrained, I can't flee and I can't fight. So there's going to be a heck of a lot of thwarted response held in the queue potentially that needs to deactivate.
Mm.
And that completion might involve a lot of big energy moving through. Ideally, we're not getting to this point, but we're talking about these very unique circumstances where
Yeah.
we're already past all this prep stuff. We're already past, like we're here now. Like we can't go back in time and try to catch it sooner. We're already here, right? So I go, okay, how do we educate owners and go, okay, now what you might see is this, now that the animal is starting to move through and come out of sedation, what are we going to see on the coming out of sedation?
Mm.
And they've done, like, it's interesting how, what is it they used to say? Dr. Levine talks about it in his book called In an Unspoken Voice. If you've never read it, it's a fabulous read.
Brilliant. Yes.
He talks about in the military, How the soldiers would go into freeze and shut down is how they would come out. So they go in, as they go in, so they come out. And
Yes.
so if an animal or a human animal are going into freeze, even if it's a drug-induced freeze, kicking, screaming, and confined and activated, there might be some of that in the queue as the thaw out of the freeze, whether it's sedation based or more physiologically driven. Watch for that. That may be there. That has survival value for that response to be in the queue just under the surface. That might be the difference between life or death in an animal in the wild that has gone into not necessarily a sedation induced freeze, but like a physiologically induced freeze. To come out immediately into fight or flight that has a lot of survival value potentially, because I might be able to get away.
Yes.
So watching for that.
Yeah, that definitely happens with both sedation and general anesthesia, and definitely see that quite a lot. So the state that they have been in before that so-called chemical immobilization is often how they come out of it. And so, if possible, trying to induce a sedation or a general anesthesia in an animal that is calm, although that word has several different connotations and may or may not be a true sort of functional state to be in. I suppose it could include some freeze, and um, and then the importance afterwards of the ability to discharge. And I think our horses' lifestyles sometimes limit this, or actually dogs. So when animals are confined or even physically held and therefore immobilized following something like that, and I think that can sometimes lock things in. I'm not convinced that necessarily something like an explosive movement might be helpful following something like that, because it might actually be dangerous. But some kind of movement, and maybe not confinement to a box, for a period of time after that, might be a practically helpful thing.
Because what's going to support this completion, right? What's going to support what has mobilized to be used up and then leave the system? Because right now they're all revved up with nowhere to go. And if they were held, or if they were confined in some sort of other way, or there was some sort of chemical restraint, every nervous system or organism is going to go through this cycle differently by virtue of its own history, its own, genetics, its own, what it's been exposed to, its own temperament, the environmental conditions at hand, the human's patterning that might be playing out here, and where it might want to punish, or because the human is fearful of what it's seeing, or human training around, oh, get that animal back in line, or that's not appropriate behavior, that's disrespectful. And then we get into these sort of anthropomorphic sort of expectations of an animal, but also of ourselves, weirdly. Like, it's natural for this cycle to unfold in this way sometimes. And it makes sense, given all the givens, that if there's a desire to flee and I can't get away and I can't fight, then I'm going to shut down, or I'm going to be raring to go. And then the second I've got some space, I might be kicking and rearing and I might move. Again, we're talking here about these unique situations. Ideally, we're catching this way sooner. And I'm gonna get to that. Yeah, ideally, we're gonna get this sooner. I'm talking about when it wasn't caught sooner, when the prep work wasn't done, and we're already here. How do we proceed, right? And because it's gonna happen, so let's prepare for it. It's like, how are the conditions supporting that? And and so this isn't about punishing the natural response or impulse that's starting to emerge. This is about, how do we then safely have the conditions so that this can move through, so that no one's injured, human or equine or otherwise. And so is there enough space available? Is this procedure taking place in an area that's confined, or is there room to move? That the humans can move away if necessary. How did the animal go into the experience? How are they coming out of it? right? And it might be that it's relatively mild and straightforward, but it could be, like you said, a bit more explosive, depending on what's happened.
Yeah.
You know?
And quite a common thing to see, not from standing sedation, hopefully, but from general anesthetics, is paddling limb movements. And in my experience, that tends to be people tend to attempt to stop that from happening because they're worried about what that means. And I wonder about, I mean, they could catch themselves, I suppose, if they're violently doing a motion like that. But it may well be the body has so much innate wisdom, and certainly there is this things like a thwarted flight response may result in the body exhibiting the pattern of flight. So they may be
Yes.
lying on their
Yeah.
side in a recovery
Yes.
box doing the paddling motions, and if
Yes.
we thwart that, then we may actually be stopping that discharge from happening.
Correct. Correct. If it was mobilized and unable to be used up, watch for the evidence of it on the way out. And so if the animal was, hello, mama, there was something moving through the backyard. So she was she had beef with whoever was walking through the yard, or
Yeah.
whatever animal was walking through the yard. So there was, so if there was in the sequence of the fear activation or the self-protective mobilization starting to emerge in response to, okay, needles, veterinarians, they smell like veterinary office, like there's all these coupling dynamics or associations, right? And this animal is starting to get stacked, and the human is starting to get stacked. And, there's all this history and there's all this stuff playing out. And there's all this, I'm revved up, but nowhere to go. I can't flee, I can't fight. And now I'm immobilized in some way, whether it's chemically, physically, or just through the physiology. The watching for the release and allowing that or supporting that to move through can be really essential. So if it is something like the legs starting to, like tremor, shake a little bit, spasm, it's all of that needs to leave the system somehow. And patterning related to what we're call trauma patterning or trauma response would be where all that energy never gets a chance to leave the system. We're all revved up with nowhere to go, and it stays stuck. And so nervous system states stay stuck. They don't move through as intended. And we're meant to mobilize appropriately. We're meant to immobilize appropriately, and we're meant to move through all of that and come out the other side. And so can we stay curious about what's showing up? Again, this is the curiosity piece. And if we ourselves have a history of what goes up does not come back down, we might be fearful of what we see there because of our own layering of it's not okay to let go, it's not safe to let go, I'm afraid of becoming violent, because there's so much of my own rage that's been held back or held down that I don't even know what it's like to allow that through. That feels daunting. That's what somatic experiencing is about as a methodology, is how do we support the moving through of what got thwarted in incremental ways so as to not overwhelm, especially given all the dynamics around, oh, well, I can't allow that because it's not appropriate, or I'm going to get in trouble, which are these very human layers. But animals have variants of this, like if I do X, I'll get punished, and there's an expectation. So it might unfold a little differently from a human expectation, but there still is this anticipatory response that, oh, if this happens, I'm going to learn how to hold that in or hold that back or suppress. And so if we can invite owners to be more curious, and even vets to be more curious about, okay, and vet techs and whoever else is in the supportive field, okay, how are we supporting the allowing of this to move through? And then watch for the deactivation, and then watch for the shift back down into a parasympathetic state, out from maybe the shutdown parasympathetic to more of a rest and digest parasympathetic. Is like, oh, and then what's happening for you? And if a human hasn't had the experience of what goes up comes back down, the human's experience might be to, oh, well, we need to rescue this horse, or we need to interrupt this, or we need to punish the fight response and the bucking or the running around or the whatever that needs to happen, because they themselves either have been taught that it's not okay, or it's disrespectful, or it's something to be afraid of, or they themselves have learned to shut that down within themselves because they were taught that those expressions were not okay within themselves. And so it's like, how do we start to hold this bigger frame? So that's on the coming out side of it, I would say. So allowing more space, for sure, allowing the room. Does that animal have animal friends, other animal nervous systems that it can, ping off of, and find safety with,
Yeah, I think that's huge
Yeah.
because we can, and maybe this is a trauma response, we can get tempted to, like you say, sort of rescue the situation. And actually, following an experience like that, a horse may prefer just the company of other horses. It may
Sure.
prefer just the company of a particular other horse and not need to deal with certain other members of the herd, maybe. Or it may a horse may be in a state where they would like you to be kind of close by, but not requiring anything of them. Or there might be some horses that they have an activity that you do together, which would be really helpful in the recovery period. I guess that all of those are possibilities.
Yes, it depends. It
It
depends
depends.
on the history. That's what I mean. Like, we can't just go, it's a one size fits all. It's like, okay, what was the history, the relational history? What's its environment relationally and environmentally, physically? What is it comfortable with? Does it have a pair bonded friend? Does it have a herd environment that it feels comfortable in? It might be that it wants the humans nearby, but not too close. It might be that it wants, humans at a distance. It might be, that it comes out of all of that and it thaws out and it's already ready to engage and it's rather smooth, you know. My horse Brando, I'll give you an example. So he's a gelding who has some interesting fear responses, and we still aren't quite sure. The jury's still out in terms of where these were learned. I have some suspicions about things that have happened in his early years that we know about after we got him. Things that happened at a boarding facility, things that happened with an early farrier, things like this. And so he has a needle shyness. Brando is not a fan. Ruby, my mare, great, no problem. She's easy peasy with needles, and she's relatively comfortable with a lot of things and takes a lot of good things or a lot of things in stride. And some of this can be historical, some of this can be sensory profile. Like, some horses will likely never find needles entirely comfortable because they have higher sensitivity.
Absolutely.
Right? Whether that's a baseline sensory profile thing or that's part of like an inflammatory trauma response thing, and they already have inflammation and pain in general. So adding more pain to a painful body is not fun.
Yeah.
Whatever it is. But he's one of those horses that he sees the vet coming and he sees that needle coming and he's already off to the races. Like, he gets stacked very quickly. And it's taken a bit of time where we've had to do some work with him where I've had to pay to bring the vet out in installments and do things not involving injection, and just getting him used to the smell of the vet and getting to have good experiences with the vet and little approximations of the thing where he experiences it within a threshold where he's not escalated and activated, and where he can deactivate at lower thresholds at earlier points in that sequence before we get to that point. And we've now gotten to a place, and I'm sure there's more we could do. Again, I'm not coming into this as a clinical animal behaviorist. I'm coming at this with some awareness of some pieces from a number of fields. And so I'm sure there's other things we could have done here. But one of the things that I recognize now is that we've built enough safety with Brando that he knows that what goes up comes back down, so that now when the veterinarian does come for injections, he's still not the greatest fan of it. We still have to have him on a line. We're not at the point where we can do this at liberty. That's a ways off, I think. But I go, okay, what is the best currently that we can aim for? Right? What is the most humane, ethical, harm-reduced way that we can approach things given where he's at currently in his trajectory? And what's cool is that, so now he's able to get an injection And it's not as stacking going into it. It's great. He's a lot lower when we go into it now. There's still some charge. It's not entirely gone. I don't know that would ever be realistic for him. Maybe. But I'm looking at it as a series of progressional experiences over time. What's improving over time each time? And what's cool is that in spite of the charge coming into sedation to, say, have a veterinary procedure, when he comes back out, there isn't all this kicking and bucking and running and expression. He thaws out and is quite normal and happy to engage, right? And so I view that also as telling me something in that, okay, yes, he goes into sedation because sedation is through the needle. He gets the dormosedent gel in his mouth, but that's still not enough to knock him out. He's a draft cross, so he's a big boy. He needs dormosedent and plus he needs the injection. But we start with that. And then we go slowly and we do it carefully, and he knows the vet, and we're taking things with thresholds in mind. So that when he does come out the other side, he's already thawing into a rest and digest, safe sociality place, even in spite of there still being a bit of stacking at the start of the curve. He comes out into the place where things are comfortable and safe, and he's fine, and there is no stacked response there. And that also speaks volumes to me. Could it be better? Certainly. It's always a work in progress, but I look at it over time. And so that's also a piece, I think, too, to consider is what's shifting.
Yes.
And he's more than happy to have me there when he's thawing out of sedation after, say, a dental procedure or something. And he's just like, oh, there you are, and he'll come and stand over me like a big plane tree. He'll just like, he always does this umbrella thing. I'll crouch and he'll come and stand over me and we hang out. And he's like this large umbrella, and he'll do it while he's dopey in sedation. He'll see me and he'll kind of, when he starts to find his feet, he'll come and wander and he'll stand over me because it's this lovely bonding thing that we do. He just comes and stands and we just hang out. And he'll do that partially sedated, like he'll come and stand over me. And I go, cool, in the midst of this experience, he still has access to me as a resource. And so this takes me to the last piece of this whole trajectory, which is the during part of the sequence. And for me, I think about if this is going to be activating or if this is going to potentially not be so great, where are the resources available that are there to help temper or moderate how the experience is experienced? And I'm thinking of some of those studies that were done where they looked at a mildly uncomfortable veterinary procedure and a horse that had its friend with it versus a horse that had a familiar human with it, or a general human. I forget exactly which condition they used. And the horse vocalized less and had fewer stress responses when the other horse the friend horse was there with it, having, say, the injection or whatever. And so I think to myself, okay, and I think some of the outcomes of some of these studies, I don't know if it's this one in particular, but some of the conclusions are like, well, horses don't securely attach to humans because they were more content to be with another horse. And I go, well, that's very anthropocentric. They're with other horses 99% of the time. Like, of course, they might be more bonded with another of their own kind. And the assumption that the human, especially the owner, is a safe source of connection for the horse is an interesting conclusion or assumption to make. Because is it that the horse can't attach or find safety in humans, or is it that there's some missing connection with this human, even though the human is familiar? Familiarity doesn't necessarily mean that there's security in the attachment or the relational bond. And so I go, okay, so as a vet, for instance, as you're evaluating the dynamics at play, like what are the conditions, what are the resources that this horse has that might help it to feel less activated in the face of this scary thing? And if you're noticing that there are disconnects between owner and horse, or human is activated or human is somewhat disconnected and not picking up on the horse's cues, the human, while familiar, might not be the most salient or the most available resource that the horse can turn to and go, okay, I feel okay in your presence. I might feel neutral in your presence. Okay, that's not awful. But I might feel ambivalent about your presence, or I might feel shut down about your presence. That's not anything we can deal with in that moment because we're dealing with the injection related activation. But as an evaluation, it's like, okay, what's going to help bring this down? What are the conditions that are contributing to the stacking related to the injection? You know, is it a very noisy environment? Is it, again, a box stall? Is it with the human owner who's got their own activation or shutdown patterning, and they're not necessarily all that attuned or able to support regulation for the animal or stay regulated themselves? You know, there's all these features, and that's, again, not to blame the owners. Humans are allowed to have their own challenges and struggle. And so it's not meant to be a pointing of a finger, but more of a, hey, like, just sort of objectively speaking, you know. And so how do we build in the resources in the midst of this scenario to hopefully reduce some of the stacking in the variable sequence that leads to some of this charge? Can we bring some of that down more? And there's more to be said, I think, about all of this, especially in terms of adding in operant conditioning and how are we adding in other bits and pieces here. But beyond going down that route, these are some of the things I would be curious about. You know?
Yeah, that's brilliant. And I so that's one of the things I teach in my courses. If it's possible, you know, if they have a horse companion that they feel safe with, if that companion can be safely nearby during these kinds of procedures, then that may help them during and in the recovery as well. And also in the preparation, we may not. So with Brando, for example, it's absolutely right that it may not be a realistic outcome expectation to have that they will become a stage where needles are totally neutral. A lot of horses, well, I mean, needles are never really pleasant, so we can only really ever, it's a tall order to make them more neutral, and that may be the only kind of situation is to make them less unpleasant as opposed to pleasant.
Right.
And there's all of the certainly possible pain in their body contributing.
Of course.
The preparation stage, especially with very thinly sliced cooperative care behaviors where you chunk things down into incredibly small pieces.
Yes.
I think one of the things that can do is that even if you have a situation before you have a robust cooperative care behavior in place, is that they have cycled through either staying below a threshold or coming back down again. They've cycled through that a few times. They've had their body has practiced it a few times. So hopefully that will be helpful, even if, and I don't think you should employ it actually, if you're using something like a start button, where the understanding between you is that they can tell you to proceed and they can tell you to pause, then you actually shouldn't use that in a situation where the needle use is non-negotiable and you aren't going to honor their please pause signal. So you actually shouldn't even have it on the table on that particular day. But the fact that you've done it before, one, you are showing that two-way communication and attunement because you're watching for their signs of, yes, it's okay to continue, or can we please pause? And they've cycled through this, being able to come back down from something that actually, you know, you don't get to the stage of worrying them as the actual procedure does.
And that's a really interesting place too, because people will often sort of they've read my blog post maybe on can animals consent, and I'm like, okay, if you don't like the word, then use assent. Like I'm not that picky. Like, you know, pick whatever word is your entry point. I get that there are like human legal connotations to the word consent, and that's fine. I'm using the word more broadly speaking in terms of, you know, this more the spirit of the meaning as opposed to the letter of the meaning, so to speak. But choice, agency, choice, whatever language works for you. And some people have said, well, if I start giving my animal a voice and the ability to say no, they're never going to say yes to anything ever again. And it's like, well, one, that's interesting that's the fear, you know, and then what does that say about the nature of your relationship with that animal? And then also maybe also your own patterning around how you learned, or learned to have a boundary or say no or not in the world.
Yeah.
But then exactly like you're saying, so then if I'm allowing them to have a no here, does that mean I never allow them, I never get to a yes? Like I'm never allowed to make any demands whatsoever. And I go, it's not so black and white, like, or it's not so polarized. Like the moving in a particular direction will involve a mid-range of nuance. And so supporting to have there be more of a no doesn't mean that we're now going to always back off when something is needing to happen that might be an emergency thing, or we have both of us conflicting needs and we've got to figure out how to navigate our conflicting needs, and that's not always done gracefully. And so like this is all just relational nuance stuff. Like it's not so polarized that if I start to support a no, that there might not be times where I have to maybe disregard that no and go, you know what, I hear that this is not comfortable for you and we kind of have to do this anyway today. How can we do this with the least amount of damage, the least amount of harm, right? How can we do this within threshold, with the most resourcing available, with, with the right conditions in place? Are the humans able to regulate themselves and, like look after themselves in that experience so they're not adding to the stacking? Can we acknowledge the no and demonstrate that we've paid attention to it and proceed in a way that shows still attunement, even if we're having to do this uncomfortable thing for emergency purposes, let's say, like there's a place for that. And then proceeding in that way is important. So even if you've taught your horse a start button kind of idea, which I think that stuff is really cool, especially if it's harder for us to pick up on the more subtle cues of yes and no, like this is in a way to sort of to accommodate the human difficulty with reading subtlety. Like let's make it really obvious for the silly human, it's like let's get a start button and a pause button so to help the horse help the human to pick up on what they're not maybe noticing. So let's empower the horse to support our limitations. It's like, we're not reading it, so let's teach them this. That's wonderful stuff, and there might be times. So I like that you're, because that would be confusing, is for those cues of, I'm going to give you choice and consent and agency to be there, but I'm going to conveniently override them. That can be very confusing and create more activation potentially, because now I'm confused. Normally you allow this, now you're not, and these things are here indicating that you're going to be supportive of that. I now have I don't know what the language would be in behaviorism. Again, that's not my main area, but there's going to now be something feeding into the coupling dynamics will be the language I'm going to use here. Something now has been added to this set of associations. Oh, my dog. I don't know if you can hear her barking. Hold on. There's a dog walking by outside.
Oh, I see. Yeah.
Hi, come. Yes. So I have a reactive.
Seems to reduce background noise quite well.
Yeah, Zoom seems to do that. Yes.
Yeah.
And so we'll see. Hopefully there isn't too much of her. She's kind of growly. She's
in the picture is very cute.
Okay. Yes, she's got this. She's what would we call a reactive dog. And so she stacks very quickly. And I think in large part, this is early development linked with her breeding. So getting her DNA testing done, she's got a mix of breeds that means that she just doesn't shut off easily. She stacks quickly and she doesn't shut off easily. So she's got she's mostly border collie, and her sub breeds are Saluki, which is a sight hound, and then German Shepherd and Australian Kelpie. So,
oh, wow.
Oh yeah. So, and Saluki's not a tiny amount. We're talking 21%, and there's a Saluki breeder within a certain geographic range of here. So it's not out of the realm of possibility that would absolutely be part of her makeup. But whether it's sound or sight or smell, she is just on it. And so, so the second anything happens, she's very quick to stack. And so that's what we're seeing right now. Yes, hi, Mama. And so right now she's starting to deactivate a little bit. There's some yawns and a little bit of her managing what's happened outside. Just someone's walking their dog. That's all. That's all it is. But for me, it's like, how do I stay calm? There's other things we can do to support her reactivity that we're kind of slowly hacking away at. But in the meantime, how am I remaining calm and not getting activated along with her? So I'm not adding to her stacking. And that at the very minimum, I think of injections as a similar process. And I go, At the very minimum, what is the minimal line that I can do here? Like if I'm thinking, okay, gosh, all of this that, Lily and Sarah are talking about sounds so complex. To a degree it is. But so we're not going to get it nailed all at once. We can't possibly. There's just too many variables. And so can we find a starting place? What's the smallest chunk of a starting place that we can enter into the sequence wherever we happen to be starting from? And just get more savvy at backing it up and getting more nuanced and catching it sooner. But at the very minimum, I go, okay, yep, she still has some of her reactivity. And how am I trying to,
some people be needle shy.
Sure, right? And so some people have their own medical traumas and their own experiences of sedation. And that's what I mean. Like it's not so separate, like that those humans also might have medical trauma, so to speak, right? Where stuff happened. They might have near-death experiences where not involving sedation, but sedation gets us close to a near-death state, right? And so if the human has had any near-death states of, coming very close to and then coming out the other side, but that hasn't been reworked. That very narrow pathway between life and death stuff has not been worked through. Anything related to sedation might be really activating, and so there can be a lot there, especially if there have been falls and head injuries and comas and lack of consciousness. And so there can be a lot in the field, and we're not going to be able to deal with it all at once. But when I think about conceptualizing the case, and this is where it's like, it depends, I go, great, here's some things I'm throwing at you, Lily, that I kind of consider when I sit with all of this, and there's more. And then for me, it's like, well, how do I best proceed? Well, then I'm looking at case specific. Here are some general things that I watch for and that I flag and that I attend to. And then there are the specifics of each individual human equine pairing in the veterinary practice, so to speak, right? And how do we then get curious about that? But this requires a bit of an overhaul in terms of how veterinary practice is done, because this is even a change in how human medical practice is done. Like this requires more time. This isn't a revolving door thing. And in many places, there are few vets and a lot of need, and there isn't always the time to do this.
Barrier.
Right. Yeah.
Yes.
So yeah.
Yeah, and protocol, unfortunately, is another, because they use, well, unless it is allowed to be flexible, you lose the it depends, and you are trying to bend a case to fit the protocol, and that's when those things don't really serve you. It's interesting. I was just going to briefly circle back around to the start and pause kind of signal idea, because and the question, well, if I let them say no, will they ever say yes? Because that like you say, is a very interesting question to come up with, and it's also, there's a few things with that. So so one thing with building the start buttons is that you can do it as a somewhat unnatural, say just trained behavior that's very specific, which they learn, something follows it, and so they give it or they don't give it. But you can also, a more effective way of doing it is to actually capture something that they're already offering, and you do that with a specific timing, and so it's actually a natural kind of assent sort of signal that you're capturing. But I think that's a little bit surface, and what's really deeper, more powerful going on is if a horse has been not really empowered at all, they haven't felt any agency, is that process of them learning that they are cueing the human, and that the human is actually responding. I think that's the game changer, and it's not necessarily, doesn't really matter which behavior it is you build. It's that process that's the game changer. But the important thing with something where we are going to have to push past their please pause signals is that maybe we have some kind of, it might be an environmental location, or it might be some objects that are around that indicate this is not one of those sessions. That's kind of a bit of a minefield, because hopefully if we are having a relationship with our horse that involves some communication and agency in both directions in a healthy way, then most of the time we are being able to respond to each other. And there will only be certain situations where we can't do that. And so, as opposed to it being, this is a session where you're allowed to say no or proceed, and in every other case, that's not happening. And if the case is that there is agency and there's communication happening most of the time, then one of the things that I think about maybe a emergency or urgent situation, there might be a bit of a relationship rupture that happens, but it isn't going to be catastrophic in the same way as if you didn't have that basis already.
Right. Yes. Well, and this is the thing I think to the takeaway, because I'm also being mindful of the time and I have to get to an appointment. But I think about this idea of, oh, like, does this require perfect attunement or and no, like we're going to misattune on the path of developing attunement, of getting to know things. We're not going to do this perfectly. And when I look at I think about the research that they did with human caregivers or parents with babies and infants, this is ages ago, like in the 80s and possibly the 90s, looking at the concept of the good enough parent, right? Good enough parenting isn't about perfectly attuning every time. And there's going to be times where you have to do something uncomfortable and they're not going to want it. And and it's a little different because we're talking primate to primate here. But there's a parallel that's similar in terms of a human infant not having the same power and agency as a human adult, and equines in human worlds are similar to a certain degree. So there's a parallel here. So it's not so much about like always offering the no, but also not offering the no. And and there's going to be misattunements, missed thresholds. Like we're going to get it wrong. Let's prepare for it. It's not always going to be perfect, but it doesn't need to be. And I think that's the piece that I want to make sure is the takeaway in all of this, is that in the path of getting to develop connection and safety with another being, regardless of species, we're going to get it wrong. And we need to have the willingness to muck around and experiment. And it's in the misattunements or the missed thresholds or the whatever, the ruptures, that the opportunity for course correction and trust building occurs. It's like, oh, wow, okay, that's good to know. Great, let's back that up, or let's make it smaller next time, or let's allow a little bit more time. And then I take a breath and, and then I allow some time. And so there's this, it's the responsiveness to the call, not so much the perfectness, but like if I respond to the call and I get it wrong, quote unquote, misattune, or there's a rupture, then how am I continuing to respond to the calls, right? Like it's the responsiveness, it's the showing up that's most important here. And I think that's what's going to create the safety overall. And I've been finding it fascinating reading this sort of new focus or newer focus in equitation science around attachment and things. And sometimes there's articles that have been published. There was one in particular in 2010 that was talking about food as a way of developing bond or security of attachment or something with horses. And I go, but in that study, food was a novelty. Of course, they showed interest in the human because it was a novel thing. Is it novelty that we're studying here, or is this true sense of attachment and security? And when I look at the attachment research, which is predominantly human oriented, and now that the animal world is starting to kind of draw this human attachment research over, and sometimes I think the conclusions drawn are not fully holding the nuances of the entire picture. So I come in as my psychotherapist hat going, wait, please, let's not forget these other bits. And one of them is it's the responsiveness to the call. And what develops security of attachment is the call and response cycle. It's the feeling of safety. It's the repairs of misattunements and ruptures. It's not using food or wither scratches and trying to use things that are in maybe the horse's ethogram. Like some of that stuff, sure, but I think about it too and I go, okay, my horse can allogroom another horse, no problem. Going at the withers for my horse, they don't really care all that much if I do that. They show no interest in it because they can offer that to each other on the regular. But I can scratch between their thighs. I can scratch their belly button. I can get areas that they can't get easily. that still isn't creating safety and attunement, but what is the, hey, mom, I'm going to present a part of my body to you and I need a scratch here, and me picking up on that and going, oh, that's not them being disrespectful because they're presenting their bum to me. That's going, I have a scratchy area I can't reach. Can you help? And then I scratch and I go, oh, that's so great. And because they can't get there. So it's not the scratching. It's not the allo-grooming,
right.
It's the attunement, it's the response to the call. That's the thing here. And it's how accurate we are. And I scratch here, and nope, that's not quite it. And he keeps nosing his flank, or she keeps nosing whatever. And I get closer and closer, and they're like, oh yeah, that's it. And then the prehensile lip starts to go, and it's so great, and you can tell they're really enjoying it. And then they're done. And it's, and then there's this thing. And it looks really like I'm not doing all that much. But it's the response, and it's getting willingness to be curious about what's being requested.
Absolutely, yeah.
And that's the piece, whether you're using a start button and a pause button, or you're just attending to the subtlety of what's shifting in their nervous system state, because a shift in nervous system state is a call that needs a response.
Yeah, absolutely, yeah.
Right? And so how do I respond to that? And it's just continually showing up and getting it wrong and then trying to get it right again, and me not going into my stuff and disconnecting further and not adding to it. It's can I stay curious enough to keep responding to the call imperfectly, and then getting more nuanced every time and more accurate every time. That's what's going to create the security, whether we want to use attachment language or not, or secure enough attachment, some variant. That's what we're going to aim for here, as opposed to I've got to get it right, and if I don't, oh no, I've done it wrong. Well, that's a trauma response.
That's a trauma response.
Yeah. So maybe we end here, because I'm recognizing
that's a brilliant
time.
That's a brilliant note to end on. I think it's also a really practical take home practice as well.
Yes.
Yeah,
definitely.
Well, thanks so much for this.
Thanks, Lily.
Yeah.
Thank you for your work too, and everything you're doing to bring these different nuances into veterinary practice, which I think there's interest there, but some of it is just sometimes the time and the conditions and the constraints.
Definitely that. Yes.
It's hard.
I think it will serve everybody better if we can try to incorporate. There's a practical element with lack of time, but sometimes it doesn't take very much more time, actually.
Yeah.
It's maybe seconds sometimes even, and sometimes it's a lot more time that's needed. But I was definitely becoming quite dissatisfied with a conventional model where patients were on a conveyor belt as opposed to individual beings, sentient beings with their story to tell.
That's right. Yeah. Well, thank you for all of that, and we'll chat again, I'm sure.
Yeah, that would be great. Yeah.
Lovely.
Have a lovely rest of the day.
Thanks. You too, Lily. Yeah.
If you would like to learn a practical, compassionate approach to asking and answering questions about how your horse feels, what they need, where they might hurt, and how they best learn and communicate, I am running an online workshop on my approach called Attuned Assessment. Workshop materials are available now in the online member area and include webinars, videos, and PDF guides. The first of 3 live Zoom Q&A calls with me is on the 6th of February at 7 p.m. GMT, that's UK time. Sign up at www.nurturingnatureequine.co.uk/attune. Thanks for listening to the Vital Horse podcast, where you can find discussions focused on helping horses in ways that combine scientific principles and evidence with compassion and understanding. Do subscribe if this content has rung true for you. To work with me in a way that honours both head and heart, check out my online and in-person offerings at www.nurturingnatureequine.co.uk. If you are facing problems or are trying to answer questions with your horse, remember that physical, mental, and emotional well-being are inextricably interconnected, that there is a wisdom to nature and to the body that we can assist, and that cultivating meaningful relationships with our animal companions holds an important key to the well-being of all of us. Deep awareness and a compassionate process will enable us to find sustainable, ethical solutions. See you for the next episode and look forward to working with you too.